Guys, can you hear me?
Hello, ma'am. Yes, ma'am.
Hello. Where is your other group mates?
They are joining.
Okay, at 15:40 we will begin, okay? We will wait them until 15:40.
Okay, ma'am.
Okay, repeat, please. Repeat last lesson about solid dosage forms and introduction to pharmacology. I will ask you that questions. Also, did we learn about soft dosage forms last week?
Yes, ma'am.
Okay, also repeat, please, these two topics. I will ask you, okay, at the beginning.
Okay.
Aisha, what happened? We called him, he said that tell them to give
Okay, guys, do you hear me?
Yes, ma'am.
Okay, let's begin our lesson. Let's ask me some questions. What do you remember about the drug and its function? Who can answer me? Okay, please, Mansur Khan. I gave you time to repeat. Okay, please. Mansur Khan, can you turn on your microphone? Okay, Usama Rahman, please.
Yes, ma'am.
Okay, Usama Rahman, please tell me what is the drug and the functions of the drug. Okay, guys, I'm asking just the information that I have explained to you and from my presentations.
Hello, ma'am.
Okay, hello.
Ma'am, drug is any type of treatment that is given to a sick person who can fight the disease or affect the disease.
Okay, and what is the functions of the drug?
Ma'am, functions of the drugs are to cure the disease or maybe somehow reduce its effects the disease.
Okay, to treat the disease. What else? What kind of drugs we use to prevent disease?
What, ma'am?
What kind of drugs we use to prevent disease?
Ma'am, there are a lot of drugs like paracetamol to cure the temperature.
No, I'm asking you what's the type of drugs that we use to prevent disease?
Prevent disease. Ma'am, there are no such type of drugs. They are just given to reduce the effect of the disease.
Oh, so what's the type of these drugs? I have explained to you that. Okay. Okay, what is the other functions of the drug? Didn't you open presentation and repeat? Please. Were you absent on the last two lessons?
No, ma'am.
So then why didn't you remember or didn't you listen to me?
Ma'am, there are a lot of functions of drugs, like some are given to help in X-rays like contrast agents, and some have functions like to cure diseases, and some have functions like to fight the other interaction diseases, to fight interactions of other drugs, like when we take two drugs at the same time, so they
No,
may
I'm
interact.
asking you now about the functions. Why do you tell me about interaction? I'm asking you about the functions.
Ma'am, its functions may include access and treatments recommendation, like during we are 24-hour emergency, to collect data on poisons, like how the disease caused, and to assist public and health care providers during hazardous material spills.
No. Please, Mariam Sabir, functions of the drug.
Ma'am, drug functions can be therapeutic to relieve symptoms, diagnostic to diagnose some disease, or maybe
Mhm,
curative, or
mhm.
maybe of replacement to help restore normal body substance or chemical deficiency.
Okay, what kind of drugs do we use to diagnose a disease? Okay,
Contrast agent.
yes, contrast agents. Osama Rahman tell you about contrast agents. So, Mariam Sabir, continue, please.
Yes, ma'am.
Also, what is other functions? Diagnose, treat, and
Ma'am, prevention.
prevention. Okay, then
Yes. Ma'am, I only know that I didn't attend the last lecture.
okay. What do you remember about the drug interaction? Shah Wali Khan, please turn on your microphone.
Yes, ma'am.
Okay, what is the drug interaction?
Ma'am, a drug interaction is between drug and other substances that prevent the drug from performing as expected.
Okay, so with which substance? What kind of interaction we talk about in pharmacology? Drug interacts with what?
Yes, ma'am. Drug interaction between the body and the medicines or drugs.
Can you repeat, please?
Ma'am, about pharmacodynamics.
No. Interaction of the drugs. What
Yes,
does it
ma'am.
mean?
Ma'am,
Interaction of the drugs.
between the drug and other substance that prevent the drug from performing is
Between the drug and another group of drugs, yes?
yes, ma'am.
Between different types of drugs. Okay.
Yes,
And
ma'am.
what kind of effects there will be if the two drugs will interact with each other? What can
Ma'am,
happen?
in drug interaction, we will always talk about drug-drug interaction between
Okay.
one drug and between other drugs.
And what they can, how they can affect to each other?
Yes, ma'am, they can affect each other.
How?
The chemical effects take place, ma'am.
Okay, what can they do to each other? Is it harmful for person or what?
Ma'am, sometimes it's harmful and sometimes it's not.
Okay, sometimes harmful. So they can decrease or increase the functions of each other, yes? And by that way, they can
Yes,
increase the side effects of each
ma'am,
other sometimes.
some drugs are not like they don't like each other, and sometimes they combinedly more efficient.
Okay, okay. And what is the pharmacokinetics? Okay, Shah Wali Khan, one more question for you. What is the pharmacokinetics?
Ma'am, body interaction between pharmacodynamics, ma'am, or pharmacokinetics.
Kinetics.
Okay.
Pharmacokinetics.
Pharmacokinetics. Ma'am, when a body affects drugs, this is called pharmacodynamic kinetics.
Okay. What our body do with the drug, yes? That's pharmacokinetics.
Yes, ma'am. What the body does to it, drugs refers to the movement of drugs in through the body, out of the body.
Okay. What kind
And
of
its absorption,
what kind of
bioavailability, distribution.
okay, What kind of soft dosage forms do you remember?
What, ma'am? I don't hear it.
What kind of soft dosage forms do you remember?
Soft dose form, ma'am, capsule, etc. Do
No, that is solid dosage forms. Soft dosage forms is
syrup, ma'am?
no.
Ma'am, I don't know about this.
Okay. Please, Isha Asif Khan. Isha Asif Khan, can you
Yes,
turn on your
ma'am.
microphone? Okay, Isha Asif Khan. What was our last topic last
Yes,
week?
ma'am.
We talked about soft dosage forms or about solid dosage forms? Do you remember what was our last topic? Guys, who remember what was the last topic that I
Solid
have
dosage
explained?
form, ma'am.
Solid dosage
Do-
forms.
yes, ma'am. Soft
I didn't
we do.
explain you about soft, yes?
Yes, ma'am.
Okay, okay. Then please, Isha Asif Khan, what is the dosage forms? What does it mean, dosage form of drugs? Please, Isha Asif Khan. Okay, Mansur Khan, can you please continue?
Yes, ma'am.
Yes, ma'am.
Okay, Isha, please. Dosage forms of
Yes,
drug.
ma'am.
What is the dosage forms of a drug?
Dosage forms are pharmaceutical drug products in the form which they are
Mhm.
marketed for use with a specific mixture of active ingredients and inactive components in particular configuration.
Okay, what
They are
are the
also called unit
two
dosage.
main? Okay, what is the two main things that contain a drug? Two main parts of the drug.
Yes.
It's API and excipient. Do you remember?
Please repeat, ma'am.
What is the main parts of a drug? It's excipient and API. So what does it mean, API? Okay. Who can answer me this question? Who remember what does it mean, API and excipient?
Ma'am, should I tell?
Okay, please. Isha,
Ma'am,
please listen. Okay.
ma'am, a drug consists of two main parts. One is API and other is excipient. The outer portion, like a PCN capsule, outer plastic covering is called excipient, while the inner, which contain active pharmaceutical ingredients, like they are called API, which
Yes,
contain the drug.
yes. And excipient is?
Excipient is there like for flavoring or taste, so they are used for that purpose. They are
Okay.
inactive drugs.
Yes, excipient is actually a material that help us to make the drug, the drug's form, the drug's color, the drug's taste, okay? That's excipient part that made from inert materials, and it doesn't have any effects on the body, yes? Any
Yes,
clinical,
ma'am.
any therapeutical effects. Okay, so Isha have left. Who else? Mansur Khan.
Yes, ma'am.
Okay. Example for you, chewable tablet. What is the excipient part here?
Ma'am, chewable tablet.
What is the
Which part, ma'am?
excipient?
Excipient.
Excipient.
Yes, ma'am.
What is excipient? For example, you'll have violet chewable tablet. What is the excipient here?
Ma'am, chewable tablets and isogenes are often a preferred dose from the farm for children and adults who cannot swallow traditional tablet. Functional excipients are often selected to help achieve the desired mouth feel and mask the bitter or unpleasant taste of the drug.
So what is the excipient then that added to the
Ma'am,
chewable
its
tablet?
color or taste like
Yes,
yes, ma'am.
it's the painting that is used. Okay,
Yes, ma'am.
color. And
Sometime patient
also,
don't know about the
also,
name.
okay. Also, what can we, chewable tablet, as you remember, it have pleasant taste, yes? Like sweet
Yes,
taste, maybe it has. So it's also excipient part, okay?
yes,
Maybe
ma'am.
some sugar was added there to make the pleasant taste, to make the sweet taste. So this sugar is also excipient, okay? Do you
Yes, ma'am.
understand?
Yes, ma'am.
Okay, okay, thank you. Zohaib Muhammad, please turn on your microphone.
Yes, ma'am.
Okay.
Yes, ma'am.
So the classification of dosage forms was based on what? Classification of dosage forms. First one
Classification
was
of drugs.
classification of dosage forms. They was
There are
classified.
soft dosage
Okay, then
like soft dosage forms like ointment.
ointment is not
Paste.
solid dosage form. Ointment is not solid.
Soft.
Soft,
soft.
okay. Soft. So
Like
first was based on route of administration. What kind of routes of administration you know?
What? Repeat the question.
Classification of dosage forms was
Yes,
divided into two parts, as you remember. First part was based on a route of administration.
Yes.
So route, what kind of ways to take the drugs, you know, route of administration? Oral, transdermal, what else?
I don't understand your question.
Sublingual.
Yes,
That's
route
one.
of administration.
Yes, ma'am.
Zohaib Muhammad, for example,
Yes,
by which way we can take, for example, eye drops?
yes, ma'am. Through
Okay.
eye.
It is ophthalmic route, okay?
Yes, ma'am. Some.
Okay.
Yes,
And for example, we
some
have got
medicines are
some
taken orally.
liquid.
Some medicines
Okay.
are taken, yes, orally.
Also,
Some
okay,
ointments
oral.
are applied on the skin.
Transdermal, okay.
Yes, ma'am. Transdermal.
Also, what kind of ways, you know?
Intravenous, some drugs are intravenous,
Okay.
like injected in the body.
Then, what else?
Oral, or some drugs are inserted through ear.
Also, subcutaneous, intramuscular, that is
Yes,
the
ma'am,
routes.
intramuscular.
Okay.
Yes, ma'am.
And second part of classification was based on physical form. So what kind of physical forms of drugs you know? You have told about soft one. Okay, then
Yes, ma'am.
soft first one, then tablets, for
Physical
example.
tablet.
It's solid.
Yes, ma'am.
Solid forms. Others, liquid forms like syrups or liquids for intravenous or intramuscular route. Gases, for example, aerosols. Do you know
Yes,
that?
ma'am. Yes.
Okay.
Yes, ma'am.
So, and also last,
Semi-solid.
yes, semi-solid also. And last lesson, we talk about solid ones. Can you tell me
Yes,
what
ma'am.
kind of solid dosage forms you remember? First one is tablet. Okay. Then there was near 10 or 11 forms.
Pills. Some are pills.
Pills. Second one, pills. Third,
Some like capsules.
capsule. Okay, then what else? Chewable tablet. Okay, chewable tablet.
Yes, ma'am.
Others.
Powder
What
pump.
else?
Powder pump.
Powder.
Powder pump.
Okay, powder. Then what
Oral
else?
granules.
Lozenges. Do you remember what is
Yes,
the
ma'am.
lozenge?
Lozenges.
Also, transdermal patches. Do you remember?
Yes, ma'am.
Okay. Next question, Zohaib Muhammad.
Yes, ma'am.
What is the prescription?
Ma'am, prescriptions are those which are written by a physician or doctor to patient.
Mm-hmm.
How like how to give some medicine or dosage form.
Okay. For the, you said it's the instruction for pharmacist, yes, and for the patient.
Yes,
For
ma'am.
the pharmacist,
Yes,
what
ma'am.
kind of information we can write for the pharmacist there? What kind of information in prescription? Also, we write
They give,
prescriptions.
first they write to give out
Okay.
some medicine, then
Active
write a
ingredients,
recipe.
yes? We
Yes,
write
ma'am.
active ingredients of some
Ingredients,
drugs. Okay.
recipe.
Then we write it is dosage, yes? Grams,
Yes, ma'am.
milligrams, how much grams or milligrams. And after that, what we do?
Ma'am, recipe.
Okay, recipe then.
Prescription.
Mm-hmm. Recipe means prescription. Okay.
Yes, ma'am.
Mm-hmm. Then we write ingredients.
Then
It's dosage. Then after that, what we should do?
recipe, ingredient, prescription,
Mm-hmm. Mm-hmm.
dosage form.
Mm-hmm. What
Then
else?
then put a slash.
Before the slash, should we write information for the patient?
Yes, ma'am.
Okay, what kind of information we should write for the patient?
Ma'am, information like how to use medicine, how many times
Okay,
in a day,
okay.
2 times or 3 times per day.
Mm-hmm. Okay, thank you. So, and last one, guys, we talk about terminology for prescription. Why do we
Yes,
use
ma'am.
Latin language? Why do we use Latin
Ma'am,
language?
We use Latin language because it is internationally used in medical terms.
Okay. And what does it mean, for example, mix in Latin language? Mix.
Miski,
Misce.
like yes, ma'am.
Misce. Okay. Mariam Sabir.
Misce.
Mariam Sabir. Thank you, Zahaib
Yes,
Muhammad.
ma'am. Yes, ma'am.
Okay. Do you remember the terminology for prescription? What does it mean, lozenge in Latin language?
What, ma'am?
Lozenge. What does it mean? Lozenge.
Ma'am, I didn't understand. What are you asking?
What I'm asking? I'm asking you the terminology for prescription in Latin language. And what does it mean, lozenge in Latin language? Transcription of lozenge to the Latin language. So, or you were absent? Mariam Sabir, please turn on your
Yes,
microphone.
ma'am. Yes,
So,
ma'am, I was absent.
and if you were absent, didn't you open the presentation and didn't you ask what we have learned from your group mates?
Ma'am, on Moodle, there is no such presentation. I opened Moodle, but
There
were
is
some
no
other lectures.
Moodle. I tell you to open WhatsApp group. In WhatsApp group, I sent you presentation. And
Ma'am, that was of soft dosage form.
before that, on the first week, I have sent you presentation of lesson number 1. Also, I have sent you 2 books and syllabus. So I have sent you that.
Ma'am, no, in group there is only one slide and that is soft dosage form, sorry.
Guys, didn't I send you presentation of lesson number 1?
You have sent only one slide, soft dosage.
Soft dosage forms. Okay,
Yes, ma'am.
Mariam Sabir, if you were absent, why didn't you ask, for example, about what you have learned?
Ma'am, actually I asked, but
You could
I
ask
only
also the
told you
notes.
what I know.
You could also ask the notes of what we have learned from your group mates. You can write to me. We have group. Okay, Mariam Sabir, next lesson.
Sorry,
Next
ma'am, I
lesson.
will be careful.
Don't miss the lessons, because I'm asking you just information I have
Okay, ma'am.
explained. Okay, even if you were absent,
Okay, ma'am.
you can open syllabus, and from there you can read the topic name, and for your own you can read from the books, from internet.
Okay,
You can
ma'am.
read, okay, and be ready. It's not
Yes,
it's not
ma'am.
my problem that you were absent. Okay.
Okay, okay, ma'am.
Okay. Okay, guys, then that was about solid dosage forms. Have you got any questions about solid dosage forms, about our first lesson? Guys?
No, ma'am.
No,
Okay.
ma'am.
So at which prescription we have stopped last week? Can you tell me, please? Can you read?
We stopped at prescription.
Read, please. Open your notebook and read me last prescription that we have wrote.
Last prescription is zinc oxide 20 gram, amyl 40 gram.
Okay. Okay.
40 gram.
Thank you. So we have learned how to write prescriptions for external usage. Okay, prescriptions for external usage.
Yes, ma'am.
There was simple powder, yes, simple powder and compound powder. Simple powder that contain just one ingredient, and compound powders that contain more than one ingredient. We have write the 2 examples. First one was benzyl penicillinum sodium, sulfatidolum, etc. And second one was about zincum, amylum, and talcum. Okay, today we will continue our prescription, but before that, let me explain you one more topic. It's about soft dosage forms. Can you hear me, guys, clearly?
Yes, ma'am.
Yes, ma'am.
Okay, so soft dosage forms is very easy topic, okay? It's very easy and short topic. I will explain you it briefly. And please take notes, okay? Take notes, because next lesson I will also ask. Okay, 1 minute. So can you see screen?
Yes, ma'am.
Okay, soft dosage forms, what does it mean? Here you should know these 3 main drugs: ointment, pastas, and suppositories, okay? Ointment, pastas, and suppositories. As you remember, our drugs contain of 2 parts. It's API and excipient. In solid dosage forms, I have explained you. So in soft dosage forms, also this kind of drugs also contain of 2 parts, API and excipient. As you remember, in solid dosage forms, excipient part was the materials that help us to make the form of drugs. Here is the same, okay? For example, in tablet, there was active ingredient, any chemical compound, any part of drugs that produces effects. So here is also like that. For example, in ointment. Ointment also contains these 2 parts. API, here can be any drug, okay? Any chemical compound that is intended to produce effects of treating, of diagnosis, of promoting well-being, and etc. So it contains this part, API part, and it contains excipient part. Mostly in ointments, we use as an excipient some kind of oils, okay? Some kind of oils like vaselinum, paraffinum, or lanolinum. Mostly we use here basilinum. Now look, API part in ointment is mostly in solid form, okay? It has got solid form. But this solid form, for example, powder or some kind of tablets, we can't apply on the skin, okay? We can't apply them on the skin. And for 1 minute, can you see screen?
No, ma'am.
No, 1 minute, some problems. Now is it visible?
Yes, ma'am.
Yes, ma'am. No visible.
Okay, so ointment's function is to be applied on the skin. After that, it will melt over the skin at body temperature, and after that, it will be absorbed to the blood. And with blood circulation, it should go to the site, okay, to the target organ or to the target cell, where it should start to work and produce effects. So, but this API part, we can't apply on the skin. That's why we should add some excipients like oils, and after that it will be easily to apply over the skin and to the drugs to be absorbed. Now look, we can take any type of API, any kind of drug in form of powder, for example, and we should mix it with some kind of oils like basilinum, paraffinum, and lanolinum. And after that, we can apply them on our skin, over the skin, over the ulcers, over the injury, and etc. After that, it will be this kind of oil with the API part will be melted over the skin. After melting, it will be absorbed. The basilinum will not cause any effect, okay? Will not cause any effect. It will just help our API to be absorbed to the blood. And in the blood, this API part will start to produce its effect. Can you understand now?
Yes, ma'am.
Okay, so that was about ointments. Second one, pastas. Pastas also contain of two parts, API and excipient. In excipient, mostly in pastas, we use such kind of excipients like talcum, mostly amylum, and zincum oxidum. Why? Because pastas density should be bigger than ointment's density, okay? Pasta's density is bigger than ointments, and it should contain more than 25% of solid units. That's why, as an excipient, we also should add here these solid units like talcum, zincum oxidum, or amylum. Can you understand?
Yes,
No,
That
ma'am.
was about. Okay, ask, please. Ask who didn't understand.
ma'am, please repeat the last one.
Which part? Which part you want to repeat me?
Pastas, ma'am.
Pastas. Okay. Pastas is also soft dosage forms. They are basically ointments. Okay, it's a type of ointments, but it's a type of ointment which have a bigger density. Okay, why? Because the solid units of this type of drugs should be more than 25%. Ointments solid units should be less than 25%. Okay, the basis,
Okay,
the
ma'am.
base
ma'am.
part of pastas is also like ointment, okay, like ointment. But in order to have the bigger density, we should add to pastas some kind of solid units. One more excipient we should add here, like zincum oxidum or amylum or talcum. Now you will understand why. Okay, ointments. Ointments are semi-solid, greasy preparations for application to the skin, rectum. We can also apply on the rectum or nasal mucosa. The base is usually anhydrous and immiscible with skin secretions. Ointments may be used as emollients or to apply suspended or dissolved medicaments to the skin. Pastas. Pastas are basically ointments into which a high percentage of insoluble solid has been added. As I explained to you earlier, more than 25% of insoluble solid was added. The extraordinary amount of particular matter stiffens the system. Now look, pastas make a particularly good protective barrier when they placed on the skin. The solid parts that contain pastas can absorb and neutralize certain noxious chemicals, okay, that was on the skin before they will reach the blood circulation, before they will reach the blood. That's why we add to pastas this kind of solid units. Like ointments, pastas also forms an unbroken, relatively water impermeable film. Okay, it's not important, but the main thing what you should understand here, the pastas have the different function because they should make the protective barrier, okay, over the skin. This excipient parts like talcum, amylum, or zincum oxidum will not be absorbed, okay, will not be absorbed. It will just all of the time, it will be over the skin and make the protective barrier, but the API part will be absorbed. In ointments, we haven't got these parts like amylum, talcum, or like zincum oxidum. There we have just some kind of oils that will also will not cause any effects. And API and this oil or excipient part will be absorbed. But in pastas, there will be solid units that will also stay over the skin and make the protective barrier. Do you understand?
Yes, ma'am.
Okay, that was about pastas. Next one is liniments. Liniments also is a type of ointments. They haven't got any difference because their functions and mechanism is the same. You should know just the name, liniments or ointments. And third one about soft dosage forms is suppository. Suppository, as you see here, it's a small solid medicated mass. Usually they have cone shape like that. They are cone shaped like this. So they should be inserted into the rectum. It will be called rectal suppository, or into the vagina, vaginal suppository. So after inserting into the rectum or into the vagina, it will melt. It will melt at the body temperature, and after that also it will be absorbed to the blood. And with the blood circulation, it will also go to the site, okay, to the target place. So this suppository also contain some kinds of drugs, API part, and also contain excipient part. Mostly suppository, for example, do you know paracetamol, for example? The paracetamol we mostly use to low body temperature. So for children, for example, they can take a lot of drugs oral. For example, this paracetamol, they can take it oral because maybe it has bad taste or it's hard for them to take it orally, okay? That's why we can use paracetamol for little babies by inserting into the rectum, okay? In form of suppositories. So there will paracetamol suppository will melt in the rectum and it will be absorbed into the blood. And after that, it will start to produce its effects, okay? Like it will start to lower the body temperature. For example, if it's about paracetamol. It doesn't matter how we will take paracetamol because the effect will be the same. If we take paracetamol orally, it will also go firstly to the GI tract, and after that it will be absorbed into the blood and will start to produce effects. Or if you will insert it into the rectum, it will be melted there, and after that it will also be absorbed into the blood, and also will start to produce effects. Do you understand, guys? What does mean suppository?
Yes, ma'am.
Yes, ma'am.
Okay,
Okay.
it's suppository. And second type, it's pessary. Pessaries are solid medicated preparations designed also for insertion into the vagina. They have the same function and the same mechanism, okay, like suppositories. But the difference between suppositories and pessaries is in their shape, okay? Pessaries have like this shape, and suppositories have like that shape. Okay, that's all. That was about our today's topic. Do you understand, guys?
Yes,
ma'am.
ma'am.
Okay, the main thing, ointment, pastas, and suppositories. The most usable forms of dosage units. Okay, have you got any questions here?
No, ma'am.
No, ma'am.
Okay, now we have left 30 minutes. Let's continue with our prescriptions. Okay, open please your notebooks and let's continue. 1 minute. We have stopped powders for the external usage. We write simple powder and compound powder. Now let me give you one more example about compound powder. And we will start to write powders for internal usage. For example about powder for external usage. Continue, okay, there. About compound one. For example, give out 60 grams of powder that contain 6% of acidum boricum. Compound powder means that contain more than one ingredient. So that's why second ingredient is 4% of acidum salicylicum and 90% of talcum. Okay, what we should do? Again, now look guys, we don't know how much grams of each ingredient we should add. We just know 6% of acidum, 4% of salicylicum, and 90% of talcum. We should find how much grams of each component we should add. Now look, 6% plus 4% plus 90%. How much percent it will be?
100%.
Okay, 100%. That means we have the total mass 60 grams. And that will be 100%, yes? And now let's find how much grams of acidum boricum we should add. It is X, we don't know X grams of acidum boricum, but we know that is 6%. So what we should do? We should again make the ratio. X is equal to 60 multiplied by 6 and divide to 100. It will be equal to 3.6. 3.6 grams of acidum boricum we should add. Do you remember, guys?
Yes,
Do you
ma'am.
remember how we solve it from the
Yes,
last lesson? Guys, everyone understand or have you got questions? Ask please immediately.
No, ma'am, understand.
Okay, you remember, yes, how we do these ratios?
Yes, ma'am.
Okay, let's find acidum salicylicum. Please comment, how should I write? Okay, 60 grams is, again, 100%. And acidum salicylicum is X. We don't know how much grams, but we know that is how much
4%.
percent?
4%.
4%. Okay, 4%. And how should I find?
X is equal to
Mm-hmm.
60 multiplied by 4
Mm-hmm.
divided by 100
Okay, it will
is
be
equal to
2.4 grams, yes?
2.4.
yes,
Yes.
ma'am.
Okay, 2.4 grams of which ingredient we have found?
Acidum
Acidum boricum.
Salicylicum. Boricum was 6%. We have found it. It was 3.6. and acidum
Yes, ma'am.
salicylicum is 2.4. And
Albina
now let's
has
find
some
third
property.
ingredient. 60 grams is again 100%. And X grams, it is talcum, but we know it is 90%. Okay, X is equal to 60 multiplied by what?
90, ma'am.
Divided by 100.
It will be 54
54
grams of
grams.
talcum. Okay, now let's write prescription. How should I begin my prescription? Please tell me. Okay. Guys, please. How should I begin my prescription? I am waiting.
RP, ma'am.
RP, yes. Then
Dot.
colon. Okay, then
Yes, ma'am. Acidum boracum.
boricum.
Yes, ma'am.
Boricum. But as you remember, I should change the ending to I. Acidum borici. How much grams?
Ma'am, 54.
3.6. No, 54 it's talcum.
Yes, yes, ma'am. 3.6.
Then second ingredient.
Second
Acidum
ingredient.
calicilium.
Acidum salicylici. Silici is 2.4.
gram.
And the third ingredient is talcum, talci. It is 54.0.
54 grams.
That means grams. Okay, so I have taken my 3 ingredients. What I should do with them? Okay, what I should do with the 3 ingredients? I can't give it separately, yes?
DS for
What?
powder.
No,
You
before
mix.
yes. Yes, I should mix.
Yes,
Yes.
mix
M and then
M
M.
dot F.
F means make, yes?
Pulvis.
Make
Yes, ma'am. Pulvis.
yes. And
Yes.
after that, I should give out. Yes, I should give. My powder is ready. That's why I
Yes.
should give. D. And after
S.
giving, I should explain. S. Okay. For
Powder.
powder over the injury and etc. Maybe 2 times a day or 3 times per day. Any kind of information you can write. After that, hashtag. That's finished. Do you remember, guys, how we write these prescriptions? It was
Yes,
one
ma'am,
more
we-
example. It's one more example for compound powders for external usage. Now let's begin powders for internal usage. Powders for internal usage is divided into 2, okay, guys? Into unseparated and separated ones. What does it mean? Unseparated means that we have amount of powder that we will take in one moment, okay? Just once, just one day, one moment, patient will take, and that's all. But separated means that the amount of powder we will divide into several days, okay? Into several days or into several weeks. And by, for example, we have 100 grams of some powder. This 100 grams, it will be very big amount if he will take in one moment, okay? It can be toxic. That's why we should divide it, for example, into 10 days. How we can divide it? We will divide it by 10 grams every day. 10 by 10 grams for 10 days. So totally he will take 100 grams, but he will take
Yes, ma'am.
it by
100
10.
divided by 10.
Yes, he will take by 10 grams every day. Can you understand what does it mean separated?
Yes, ma'am.
But some kind of powders we didn't divide, okay? We don't divide. We just take this 100 grams just one moment, okay? In one moment. Okay. What kind
Okay,
of
ma'am.
powders
Unseparate.
we should, okay, unseparate. And what kind of powders we shouldn't divide? It's, for example, about, do you remember contrast agents? These contrast agents, I have explained to you that they also have powder form. They in form of powders, and we should dissolve them in water, and patients should take it before the diagnosis. And after 1 or 2 hours, when these contrast agents will reach intestine, for example, we can take the picture of intestine because it will highlight the areas of intestine, the walls of intestine, the structure
Yes,
of
ma'am.
intestine. Okay, that's why we should, in this case, we should take this powder just in one moment, okay, just once. He didn't need to take it's for 10 days or for 7 days, okay? He will take it just once. For example, but others, the drugs for the treating, for example, we always should separate, okay? We always should separate for 10 days, for 1 month, or etc. Okay, for example, here, unseparated, give out 100 grams of barium sulfates. So this barium sulfates is contrast agents, okay? Barium sulfates. Protein means for X-ray. Protein. So how we should how we should write here prescription? RP. Firstly, we should write our active ingredient. Active ingredient here is barium sulfates. Barium sulfates pro rentgeno. How much milligrams? 100, not milligrams, grams. 100.0. As you remember, 0.0 means grams. We didn't write word grams in prescription. We just put the dot 0. That means grams. And okay, our ingredient is ready. Pharmacists take 100 grams of this barium sulfates powder, put it into the pocket or into the box, and he should what? He should give out, yes? D, denture. He should give out and explain, S, explanation, signal, what he should do. Patient should take after dissolving in water before the diagnosis. Do you understand, guys?
Yes, ma'am.
Okay, who hasn't understand? Who has got questions? Please ask. Everybody understand?
Yes, ma'am.
Yes, ma'am.
Others, do you understand?
Yes, ma'am. Yes, ma'am.
Okay, that was unseparated powder. Second type of powders for internal usage is separated. Separated. Separated means I have explained to you that we should divide this amount to several days or several weeks. Okay, for example, let's write a simple one that contains just one ingredient, yes? Give out, for example, 12 powders that contain by 1 milligram of phenobarbitalol, for example. Now look, what does it mean? It means that each of these 12 powder should contain by 1 milligram, okay? And totally, how much milligram will be taken by the patient? Okay, guys, if he will take by 1 milligram for 12 days, totally he will take how much milligrams?
12 milligram, ma'am.
12 milligrams, okay. But he can take 12 milligrams in one time, okay? We divide it into 12 days. That's why give out 12 powders. That means pharmacists should give him 12 different pockets or 12 different little boxes, okay? In each of them, there will be by 1 milligram of phenobarbital. And patient will every day will open by one pocket or by one box and he will take just by 1 milligram of phenobarbitalum. Okay, do you understand this?
Yes, ma'am.
Yes, ma'am.
Okay. How we should write, how we should explain to the pharmacist that he should give it separated, not in not 12 milligrams in one box. We should explain it. How? Now look, RP, we should write our active ingredient, phenobarbitalum. Phenobarbital. Phenobarbital. 1 milligram. Milligram, we should write 0.1. That means milligrams, okay? If there will be grams, we will write 0.1. It mean grams. But milligrams, we write like 0.1, okay? Okay, phenobarbital 0.1. What he should do? He should give out such doses. Such means tales, as you remember from prescription or from terminology. Tales means such. D tales, doses, this word, DTD. So give such doses, that means such doses by 1 milligram, such doses, number, how much he should give by 1 milligram, number 12, yes, number 12. Give such doses, number 12. And after that, he should explain, as we have already write D, that's why we didn't write again D, we write just S. Take by 1 powder every day for 12 days. And that's all. Do you understand, guys?
Yes, ma'am.
Yes,
Have
ma'am.
you got any questions?
No, ma'am, no.
Okay, that was about separated powder, okay? Separated, they also can be simple or compound. If there will be compound, for example, let's write one more example about compound one that will contain more than one ingredient. For example, give out 15 powders that contain by 5 milligrams of acidum ascorbinicum and 2 milligrams of rutazidum. Okay. Again, RP, active ingredients. First one is AC ascorbinic, 5 milligrams, 0.5. Second ingredient is rutazidum. Rutazid is 0.2. And after that, that is powder for internal usage. Okay, acidum ascorbinicum and rutazid, it's about vitamins. Okay, here I can add the taste of this drug, the taste of this powder will be very sour. Okay, like a lemon. Okay, it will be sour. That's why I can add some excipient here. Okay, guys. I can add some excipients to make it more tasty, to make it sweet, for example. Can I add here? How
Yes,
do you
ma'am.
see?
Yes,
add
ma'am.
it.
Yes.
Okay, I can add some sugar, for example, yes, to make it more tasty, to make it sweet. Sugar, for example, it will be in Latin language, it means saccharum, but I write saccharine. How much of saccharine I can add? Now look, we have one rule for the compound powders for internal usage, that total mass of them shouldn't be more than 1 milligram. It's always should be equal to 1 milligram, okay? That's why how much milligrams of sugar I can add here? Okay. 0.5 plus 0.2 is equal to 0.7.
0.7. Then
Eh,
0.3.
okay. And how much of saccharum I can add?
0.3.
Sugar.
Yes,
0.3.
0.3. Because total mass shouldn't be more than 1 milligram. Yes, that's why I can add
1
here.
milligram. Yes, ma'am.
Yes, I can add here 0.3 milligrams of sugar. Okay. And what I should do with these three ingredients? I should mix. Yes, mix, make, fiat. What I should make? I should make pulp powder. After that, I should give out such doses, DTD. My every powder of this 15 should contain such amount of ingredients, okay? Each powder should contain this amount of ingredients. That's why DTD number 15. Okay, that's all. At the end, I should write explanation, yes? Yes. Take by one powder 3 times per day, for example. 3 times per day. Do you understand, guys?
Yes, ma'am.
Okay, that was about unseparated and separated powders for internal usage. Last prescription about powders is also powders for external usage. Powders in capsules. Some kind of drugs, okay, some kind of medicaments, some kind of APIs have got very bad taste. That's why it will be hard for patient to take the powder of this drug. That's why we should put them into the capsules, okay? Into the capsules. It will be easier for patient to take it, okay? That's why powders in capsules. How we should explain to pharmacist that he should put this powder into the capsule? Now look, we have task, give out 30, for example, gelatinous capsules that contain by 10 milligrams of doxycyclinum. Doxycyclinum, it is antibiotic, have very bad taste. Again, RP, my active ingredient is doxycyclinum. I should write doxycycline. How much milligrams of doxycycline? 10. 0.10. I will write 0.10. Doxycycline 0.10. How I should give? I should give such doses, DTD, give such doses, number 30 in caps. That means in capsules. In capsules, I write just caps. In caps, gelatinous. I write just gelat. In caps, gelat. So that's all. After that, I should write explanation. Signa. Take by 1 capsule 3 times per day for 10 days. Yes, he will take, if he will take by for three times, it's for 10 days. Do you understand?
Yes, ma'am. Before
Yes,
meal or
ma'am.
after meal?
Before what?
Meal,
Before
ma'am.
meal. Maybe after meal or before meal. You can take after meal. You can write. Then for the after meal. Okay. That was all about powders. about external powders and for internal usage. Have you got any questions?
No, ma'am.
No.
No, ma'am.
We have left 10 minutes. Let's begin write the tablets. Next lesson, we will continue them, okay? Tablets. Tablets. Tablets also is solid unit, solid dosage forms. Tablets prescriptions is very easy, okay? They also divided into simple and compound. What does it mean simple? It's when it contains just one active ingredient, okay? For example, give out 10 tablets, 10 tablets that contain by 5 milligrams of diazepam. Diazepam. Okay, again, I should begin with RP. My active ingredient is diazepam. I write diazepam, 5 milligrams, 0.5. And what I should do, I should give out such doses, DTD again, such doses. Every tablet should contain such doses, such 5 milligram, okay? That's why DTD number, how many tablets I should give? 10, number 10. And how should I give this ingredient? In tablet. In tab. After that explanation, yes. Take by 1 tablet 2 times per day. Do you understand? Simple tablets. Okay, guys, do you understand?
Yes, ma'am.
Okay, that was about simple tablets. Can we write one more example, or you have tired?
Ma'am, it's enough.
It's enough, ma'am.
Okay, next, let's continue then next time. Write just the name. Next time you should remember me where we have stopped, okay? Next example will be about tablets. Write please this. Tablets covered with a shell. Covered with a shell. Okay. Next lesson, you should remember me that we should continue from here, okay?
Okay, ma'am.
Okay. So guys, did you write everything today?
Yes,
ma'am.
ma'am.
Everybody have written?
Yes, ma'am.
Okay. Can I close this page?
Okay, ma'am.
Okay. So, have you got any questions? Usama Rahman, did you understand everything? Have you got questions? Okay, Usama Rahman, are you here?
Ma'am, he has internet issues. He told me before.
Okay, Shah Wali Khan, did you understand
ma'am.
everything?
Yes, ma'am. Yes,
Any
ma'am.
questions?
I write it in copy. No, ma'am. It's in-
Okay. Mariam Sabir,
Yes, ma'am.
did you write everything?
Yes, ma'am. I wrote everything.
Any questions? Did you understand? You were absent
No.
last week,
Yes, ma'am. I understood.
but today, do you understand?
Ma'am, I
The
understood. Yes,
okay,
ma'am.
prescriptions from the last week, you should take from your group mates, okay? Ask them, they will send to
Okay,
you.
ma'am.
Okay. Shah Wali Khan, please send to Mariam
Okay, ma'am.
Sabir last lessons prescriptions, okay?
Okay, ma'am.
Okay. Mansur Khan,
Yes, ma'am.
any questions? Do you understand everything? Did you write everything?
Ma'am, Yes, ma'am, I write everything. But one question, ma'am.
Okay.
Ma'am, what is the main difference between the drugs they're taking after meal and before meal?
Some kind of drugs it will be very absorbed in stomach juice, for example, okay? In stomach
Okay,
juice,
ma'am.
and some kinds of them will be not be dissolved in stomach juice, okay? That's why we should take them after meal, when the meal will be mixed with this juice, okay?
Okay, ma'am. How
It
we
depends.
recognize it?
You should just remember it, okay? You should just learn the instruction of drugs, okay?
Okay, ma'am.
Next one, Zahaib Muhammad.
Yes, ma'am.
Did you write everything?
Yes, ma'am.
Any questions?
No, ma'am.
Okay. And last one, Isha Asif Khan.
Yes, ma'am.
Okay, did you write everything? Have you got any questions?
Ma'am, please send previous lecture.
Okay, I will send you previous lecture. Now you should write in group, okay? Remember me, write in group. And didn't I send you the books, the syllabus and presentation, guys?
No, ma'am.
No, ma'am.
As I remember, I have sent this to every group. Okay, 33, I will send you
Please
now.
send again.
Okay, so for the next lesson, guys, for the next lesson, you should read about, so you should again repeat solid dosage forms, soft dosage forms, today's topic, I will ask them, and introduction to pharmacology, I will also ask, and next lesson, our topic will be pharmacokinetics and liquid dosage forms. In your syllabus, you can open and look. For the next lesson, I will ask you and I will put you grades. Please repeat
Okay, ma'am.
and be ready for the lesson, okay? Liquid dosage forms and pharmacokinetics. Also, don't forget these two topics, soft dosage forms and solid dosage forms. So if you understand everything, see you then next week.
Okay, ma'am. Thank you.
Okay, ma'am. Goodbye.
Okay, see you guys. Goodbye.
Okay, ma'am.